Welcome back and thank you for staying with us. Also on the program, we will be talking with attorney Jean-Paul Rudd. He's a partner at Adams and Adams. He is an attorney and he's going to be talking about the COVID-19 vaccine. And I suppose we're going to be talking rollout and just what that is going to be entailing. But right now we cross over to Kenya in obviously way up north and possibly, I think it's Nairobi. And we'll be talking to Dr. Miriam Mutebi. She's a breast surgical oncologist, also an assistant professor in the Department of Surgery at the Aga Khan University Hospital in Nairobi. She's also the vice president of East Africa of the African Organization for Research and Training in Cancer, treasurer for the Kenya Society of Hematology and Oncology, and on the board of directors of the Union for International Cancer Control. It gives me absolute pleasure to be welcoming this amazing lady to our show this morning to talk about something truly, truly important and close to our hearts. Good morning, or is it good afternoon? Welcome, and what a pleasure to have you on the show.
Thank you, Julie. Happy to be here.
Gosh, what a string of achievements. You probably have just not stopped studying from the time you entered university.
I'm going to tell you a cheeky joke. There's a time I used to write a profession student because it almost feels like you spend your entire time in school, right?
Right. And why not? Why not? If it's for the betterment of humanity, God bless. We applaud people like you. You know, we need people like you in the world to just keep on learning and bringing your work and healing the world, so to speak. It's World Cancer Day, and without being disrespectful, cancer is a dreaded disease. 1 in 5 women or 1 in 10 women around the world are, afflicted with some form, women and men and children. So the entire population are, afflicted with some form of cancer at some point in their lives. And of course, we need to do everything to create the awareness, to make people safe, to make people healthy. But with due respect to you and your campaign, I'm just wondering how much of traction you're going to gain with this campaign of yours in the light of this horrible pandemic that everybody is talking about the world over. And of course, I'm referring to COVID-19.
Yes. Thanks, Julie. I think we have taken a couple of hits, especially as a result of the pandemic, and looking at the body of evidence that, looking at the data that's emerged, I would say over the last year, we've seen that quite a number of countries have been hard hit by the pandemic as far as the cancer services are concerned. I think the World Health Organization, very early, sometime in May, actually did a survey of about 155 countries, and half of them actually reported that, either their cancer services had either been partially disrupted or fully disrupted. And so we're looking the whole, I think this is a time that we actually do need to reiterate this campaign. As oncologists, we say, the pandemic has literally stopped everything in its tracks, Julie. Except the cancer cells, because those are still growing. And so it's important that even as we think about how do we, improve, or how do we deal with this pandemic, we still need to think about what are the other factors that are going on that is still the other illnesses, because all of these other, not just cancers, other non-communicable diseases, we're also seeing an increase in, maternal mortalities, infant mortality. So the whole spectrum of healthcare, including other non-communicable diseases, does need to be addressed. I mean, as part of the lockdowns, we were in Kenya, we had our lockdown from around March to around August. And so what was happening was we were seeing ladies coming in with lumps all the way from, February and coming in much later. And I think even the the narrative that we tell, because I think initially at the start of the pandemic, Julie, there's a lot of fear, a lot of uncertainty. One would say there's actually an infodemic. There was a lot of information coming out and everyone was scared. And the message was that you go to the hospital, you get COVID, you die. Because talking to our ladies, you'd say you felt this lump in February, yes, and you thought it might be worrisome, yes, and you didn't go and get help, but just because of that fear. And we're saying that, listen, even as we think about how to address the pandemic, we do need to think about how are our health systems functioning and how are we dealing with the other concerns for all our patients. We've seen there's been a drop in patients, coming in for screenings, patients coming in with more advanced cancers, and this ultimately has implications. So even from a health systems perspective or from a policy perspective, it's more expensive to treat a disease that is more advanced, irrespective of what it is, whether it's heart disease or cancer. It's more expensive for the system to treat that disease than if you're able to, prevent it or pick it up early. And so it's important that we make sure that this narrative continues to go on despite whatever else is going on globally.
And sadly, the entire global population are in a grip with, we panicked. We are panicked with COVID-19. And there is not a family or someone who knows someone who's been impacted by COVID-19. Sadly, in my family, we lost a nephew 2 weeks ago at the prime of his life, 33 years old, and he died of COVID. And he was never sick in a day in his life. And having said that, you look at patients with other with other illnesses like your cancers. I'm even thinking about patients who have to go on dialysis. What's happening to them? And HIV and AIDS and all other dreaded or chronic diseases. Everything seems to be put on hold because of COVID-19. So how is it impacting, apart from the cancers progressing even further? How deadly, if you are treating a cancer patient, I guess the question is, how much at risk are they, being a cancer patient, of contracting COVID?
Yeah, so great question. Of course, because you patients who have cancer have a relative immunosuppression, either as a result of the primary cancer or some of the therapies they're having, whether it's immunotherapies or chemotherapies that would lower your immunity, then for sure they are at, one would say, a slightly higher risk of getting other illnesses. And so this is why we're saying, despite COVID, we do need to think creatively about what are the strategies that we can use to deliver care. Part of the care delivery has to be in a safe environment. Like in our oncology center, we're trying to limit the number of people coming in. Coming into the, not too many, usually sometimes you would come in for chemo and you have the entire, community there with you. We're trying to limit those in recognition of that fact. We're also trying, I think it's also been, Julie, the silver lining is that we are also seeing opportunities to innovate and think about how can we deliver care better. And so we're looking at things like, telemedicine. If a patient doesn't need to come in, especially the ones who've been, on regular follow-up and are coming, or maybe on the regular medication and have to come in after, like a couple of months, where, maybe calling them up and having that conversation. And our preliminary responses have been great. Sometimes the patients say that, sometimes when the doctor's on the phone, I actually have more time than when they're on a busy clinic, sort of trying to get through the many patients there. So I think despite all the things that are going on, and we're saying, yes, we've taken a hit, but I think there's been an increase in, I would say, innovations around our care delivery, but also just, I think we've never had so much Zoom until right now. And so this has also provided an opportunity for both, patients and clinicians, because initially people were sort of operating in silos, but now we're slowly getting to the recognition of the benefits of multidisciplinary approaches to care. We're engaging more, we're discussing our patients together, which can only be good for the patients. And then even in terms of looking at how do we then continue to provide the support services, we're having support groups that are moving online. And so these are providing avenues that people can, utilize to at least ensure care delivery. However, the caution is always, Julie, that you want to make sure that, despite these innovations, they don't necessarily emphasize or worsen disparities. So we do need to look at, okay, if I don't have, data or Wi-Fi, how do I then still, ensure my care delivery continues? In Kenya, for instance, we've had to increase our patient navigation in public institutions, where the thing about Kenya is that we have 97%, almost 100% phone coverage. So everyone has a phone, and exactly. We're still doing not so well on running water and everything else, but we're getting there. And we're saying, if you're even just getting a dedicated nurse to, sit and make a call and find out how are you doing, actually encourages patients to, continue their care throughout this period. And of course, it's also been a very challenging time, Julie, mentally, just the strain of the anxiety and uncertainty. So we've seen an emergence of quite a number of online support and psychological services for patients. So this has definitely been a win, I would say, despite everything else that's going on. And it's just, I think, creatively thinking as a global community, how do we pool those to, strengthen systems going forward?
Well done on you guys. But are we making inroads in terms of treatments of cancer? Is there, it might be a stupid question, but are we seeing a vaccine against cancer somewhere along the line, possibly at the, on the horizon? Are there newer and more better and efficacious treatments that we're seeing? How much more research is going into cancers? Because I can remember way back when I started, radio and TV, that the big story was our yearly Cancer Awareness Day story. And last year, because of total lockdown all around the world, I don't even think cancer got a mention. And, kudos to you for, and your organization for bringing it up and making us aware that, hey, there are other dreaded diseases and chronic diseases that need to be paid attention to, cancer being one of them. Are we making strides? And how much more do we put out there to create awareness and for people to take care of themselves?
Thank you for the questions, Julie. There are a couple of questions in there, and I think I'll start off with the question around, are we making strides and how much research? Now, unfortunately, as a result of the pandemic, what's happened is that research funding, because there's, again, a limited pot, has been diverted to looking at COVID and COVID-related concerns. However, there's also been, ironically, on the other hand, there's been, one would say, more of a global coming together to look at what are solutions. And so as a result, we've had accelerated processes, the processes that would generally take 10 years to approve. We're getting rapid approval and rapid sort of shifts towards in terms of new drug development. But looking at how can we then leverage that for our cancer is a question that we have. And then in terms of looking at, you asked about the vaccine, and whereas not necessarily...
Sorry for the interruption. I am aware that the HPV vaccine supposedly has been introduced and has been making, I hope, a huge difference.
Absolutely. And that was what I was going to reference as well, because again, last year we have had a global commitment to elimination of cervical cancer, and we're looking at clear goals for 2030, and the vaccination and just is part of the discussion around how we can eliminate this. But it's not just the vaccine per se, Julie, because one would ask then, how do I, sitting in my room or sitting at home, how do I make a difference? And I think what we need to do as a global community is have discussions around what are the barriers? I mean, some in quite a number of centers, there's been lots of resistance to the vaccine. There's lots of cultural taboos about even talking about, in certain communities, you can't talk about the breast, you can't talk about reproductive health. And so as a global community, in order to support, the battle against cancer, it's again, how do we increase awareness? It's discussing these in public spaces like your wonderful show, breaking down the stigma around what it means to have cancer, breast cancers, reproductive cancers. Look at what the myths are, try and break those down, and try and get each of us to take ownership of our own health. Sometimes we joke and say that we treat our cars better than we treat ourselves, because every couple of miles you take it to the garage, and then for our bodies, we just wait for the system to break down, and then you're getting a tow truck. And so we're saying that a third of cancers are preventable, and through simple measures like health and diet. Diet and exercise. And so if we're actually able to do these strategies, improve our health-seeking behavior, sometimes people say, why do I want to go and look for trouble? And we're like, actually, you do want to find the trouble early and sort it out better,
Absolutely.
Yeah,
Absolutely.
yeah.
This year's World Cancer Day theme, what is it? And I'm also wondering, because I'm talking to you way north up in Africa, how are you getting these very important messages out into the rural areas? Because cancer doesn't only affect women in cities, in urbanized areas. Cancer is widespread all around. So 2 questions there. The theme, what does it mean for you and I, and how are you getting this very important message to the rural women?
Okay, so thanks, Julie. So this year's theme, which was started by the Union for International Cancer Control, the UICC, is I Am and I Will. And we're currently doing our 3rd and final year of this theme. But basically, the theme is a call to action for every individual, every institution, every organization. And the underlying ethos is that we can all do our bit to make a difference, whether it's from an individual perspective, a systems perspective, an organizational perspective, or a policy perspective. Sometimes you think, as I said earlier, you're sitting down and thinking, I'm sitting in my office, what can I do to make a difference? 1, you can take ownership of your health. 2, you can reach out. These are troubling times. We say, call up your neighbor who has had cancer. Just find out, how are they doing, right? Get in touch with your local cancer support groups and figure out how can you help, and just spread the message that we do need to take ownership for our health. In terms of the how do we then disseminate or percolate this to the rural areas? That's a key question that we've all been grappling with at a systems level, because even in fact, in terms of access to cancer services, what has been traditionally the norm is that they've been mainly in urban centers. And so our women are having to travel long distances, men and women are having to travel long distances in order to access care, maybe sometimes even over 400 kilometers. So that definitely does need a deliberate effort, and this has to be at a policy level. And this is why part of the I Am and I Will campaign is not just on the individual level. We're also, challenging our policymakers to say, hey, can you develop, national cancer control plans? And even as you develop those plans, think about, how do I improve access for the little, for the little girl in the village? How do I improve access for the gentleman who has to travel over 400 kilometers? And part of that is decentralizing services, whether it's either through, making sure they're all interconnected, but, bringing services closer to the people. Again, part of the strategies that we're using is actually leveraging community. There's so many community health workers and champions. Like, we all have, I would say, strongest attribute, I would say, in Africa is our sense of community. There's always a sense of community. People want to get together, they want to gather, they want to talk. And so we're looking at how do we leverage that? And we can get community champions who can, get to the villages, get to the kitty parties, as it were, and spread this message. And we're definitely going to do a lot more towards raising awareness.
Well, it's been an absolute pleasure talking to you. I'd love to talk again about other issues, and so we will be in touch. Good luck with the campaign. And yes, we do need to be behind campaigns such as these so that people don't forget that there are other illnesses, dreaded disease, other areas that need attention as well. So good on you and the organization, and certainly we'll be in touch. Thank you indeed, and have a great day.
All right. Thank you so much, Julie. I think I would just leave it with cancer is not a death sentence, because I think the narrative, we definitely need to shift the narrative around cancers. We automatically think cancer equals death. But what we know is if, detected early, treated appropriately, most cancers can be cured and they become just like any other chronic illness.
There you have it, Dr. Miriam Mutebi, a breast surgical oncologist and assistant professor at the university in Nairobi. What a pleasure talking to her. And we move on at 12:47, a very short ad break, and then we're going to be talking vaccine rollout.